Here is a detailed explanation of dolutegravir. Number 1. Generic name, drug class, drug forms, brand names. Generic name, dolutegravir. Drug class, integrase strand transfer inhibitor, INSTI, an antiretroviral class of HIV drugs. Available drug forms, tablets 10 mg, 25 mg, 50 mg. Fixed dose combinations, often combined with other antiretrovirals such as abacavir, lamivudine, or rilpivirine. Brand names, Tivicay, dolutegravir alone, Triumeq, dolutegravir plus abacavir plus lamivudine, Juluca, dolutegravir plus rilpivirine, Dovato, dolutegravir plus lamivudine. Ammunition. Dolutegravir is an antiretroviral medication used to treat HIV-1 infection. It belongs to a class of drugs called integrase inhibitors, which block the virus from integrating its genetic material into human cells. Dolutegravir is used in combination with other HIV medications and helps decrease the viral load in the blood, improve immune function, and reduce the risk of developing AIDS-related complications. 3. Mechanism of action. Dolutegravir inhibits HIV integrase, an enzyme essential for viral replication. Steps 1. HI converts its RNA into DNA via reverse transcriptase. 2. The viral DNA must be integrated into the host's genome using integrase. 3. Dolutegravir binds to the integrase enzyme, blocking the strand transfer step of integration. 4. This stops HIV from multiplying and infecting new cells. Number 4. Uses. Treatment of HIV-1 infection in adults and children, 4 weeks and 3 kilograms. First-line therapy in treatment-naive patients. Switch therapy for patients with viral suppression on another regimen. May be used in post-exposure prophylaxis PEP when included in a regimen. 5. Indication: dolutegravir is indicated as part of combination antiretroviral therapy (CART) for treatment-naive HIV-1 infected individuals, treatment-experienced individuals, pediatric patients 4 weeks of age and 3 kilograms, in combination therapy for maintenance in virologically suppressed patients, in dual therapy regimens such as dolutegravir plus rilpivirine or dolutegravir plus lamivudine. 6. Contraindications: hypersensitivity to dolutegravir or its components, co-administration with dofetilide, Ticlocin. Dolutegravir increases its concentration, risking life-threatening arrhythmias. Severe liver disease, precaution rather than absolute contraindication, depending on severity. HLA-B 5701 positive patients should not take Triumeq due to abacavir. 7. Before taking this medicine, precautions. Inform doctor if you have kidney or liver disease, you are pregnant or planning pregnancy. Dolutegravir may cause neural tube defects if taken during the first trimester. You are breastfeeding. HIV-positive mothers are generally advised not to breastfeed. You are taking supplements or medications, especially iron, calcium, magnesium. You have a history of mental health disorders, including depression or suicidal ideation. You have hepatitis B or C co-infection, requires monitoring. 8. How to use. Oral administration, swallow whole with or without food. With mineral supplements, CA, Phe, Mg, Al, take dolutegravir 2 hours before or 6 hours after to prevent interaction. Take at the same time each day. Do not chew or crush tablets. 9. Dosing information. Adults. Tivicay dolutegravir, 50 mg once daily, treatment naive, 50 mg twice daily, if resistance to integrase inhibitors suspected. Fixed dose combinations. Triumeq, 1 tablet daily. Juluca, Dovato, 1 tablet daily in specific virologically suppressed patients. Children 4 weeks and 3 kilograms. Weight-based dosing. 3 kilograms to 6 kilograms, 5 milligrams once daily. 6 kilograms to 10 milligrams once daily. 10 kilograms to 14 kilograms, 15 milligrams once daily. 14 kilograms to 20 kilograms, 20 milligrams once daily. 20 kilograms to 25 kilograms, 25 grams once daily. 25 kilograms and above, adult dose, 50 milligrams once daily. Number 10, missed dose and overdose. Missed dose. Take as soon as you remember. If it's close to the next dose, skip the missed one. Do not double dose. Overdose. Symptoms may include nausea, headache, fatigue. No specific antidote, supportive care is provided. Seek emergency medical help or call poison control. Number 11, when to stop or avoid taking. Stop taking dolutegravir and seek medical attention if you experience severe allergic reactions, rash, fever, swelling. You develop signs of liver damage, yellowing of skin or eyes, dark urine, abdominal pain. You have life-threatening hypersensitivity or severe psychiatric symptoms. If your doctor recommends changing the therapy due to treatment failure or side effects. Side effects detailed. Common side effects: insomnia, headache, nausea, diarrhea, fatigue. Less common side effects: rash, fever, elevated liver enzymes, ALT, AST. Serious side effects: hypersensitivity reactions, may involve rash, fever, organ dysfunction, liver toxicity, jaundice, liver failure. Neuropsychiatric effects: depression, anxiety, suicidal thoughts. Immune reconstitution syndrome, IRIS, worsening of opportunistic infections after starting therapy. Weight gain, especially in women and Black patients. 13. Vital information. Do not discontinue dolutegravir unless advised by your doctor. Always use in combination with other antiretrovirals. Regular monitoring, CD4 count, HIV viral load, liver and kidney function tests. Dolutegravir may increase serum creatinine without affecting actual kidney function. Maintain strict adherence to prevent drug resistance. Number 14. Other drugs that will affect dolutegravir. Drugs that decrease dolutegravir effectiveness. Rifampin, carbamazepine, phenytoin, phenobarbital, St. John's wort. Drugs affected by dolutegravir: increased levels. Metformin may increase risk of lactic acidosis. Dofetilide, contraindicated due to risk of life-threatening arrhythmia. Minerals and antacids. Calcium, magnesium, aluminum, iron supplements bind to dolutegravir, reducing absorption. Take dolutegravir 2 hours before or 6 hours after such substances. Thank you. Have a nice day.